United States Senator Roy Blunt joins us on the phone line. Roy, good morning. How are you, sir?
Hey, Tom, I'm good. How are you, my friend?
Doing very, very well. I want to salute you so much for this. I was watching one of the videos of you speaking in Washington recently about the Health Care Act, whatever the heck it's going to be called. Obama has referred to it again as ObamaCare, so I guess that's what we're calling it again. And you step out and you say, and I have one of the quotes in front of me, whether the Obama administration actually reached their estimated enrollment numbers or not, that doesn't change the fact that this law is fundamentally flawed.
Well, I believe that's absolutely true. And, this is exactly what I said when the website wouldn't work. But whether the website works or not can't be a measure of whether this is the right thing to do, nor can any particular sign-up number of people who may feel like they have no other choice. But what we see is a law that the people can't afford. They have high deductibles that for many families, the deductible's so high it's almost the same as not having insurance at all. And you can't keep your old insurance policy if you liked it. You can't, in many cases, get to the doctor you've always gone to. And the measure here has to be, is this a better system than the system we had that we could have created new ways for people to have more access to without affecting everybody's health care, that thought that their health care coverage and their health care options were what they and their family needed and could afford.
You spoke on the Senate floor yesterday, and you mentioned that there are people from the state of Missouri that you've talked to that have contacted you, emails, phone calls, messages, about their issues and problems so far. More of these horror stories coming in about Obamacare. Can you share some of that with us right now?
Well, I can. Harry Reid says all these stories aren't true. Of course they're true. Now, there may be somebody out there telling a story that's not true, but not the Missourians that contact us. I've been going to the floor, Tom, at least once a week for weeks now, talking about the families and the individuals that are contacting us that had coverage on the Missouri high-risk pool, which was eliminated on December 31st, that worked for them. That one of the things we could have done was expand access to the high-risk pool for people who had a pre-existing condition. Those people in our state were paid about 135% of what the premium was then. Virtually all of them now are paying a higher premium for less coverage than they had. These are stories. I've not gone to the floor with a story that we haven't contacted the person another time and said, now, Senator Blunt's going to go to the floor and talk about this. He's going to use your first name and the town you're from. Are you troubled by that? And over again, they say, not only are we not troubled by it, we want our story told because it's having real negative impact on our family, and this system is not working for us.
The stories include, and one of the things you mentioned yesterday, is that we have the quickest rising area of bills in hospitals that are reporting across the country are related to people who do have insurance.
Well, I think that's probably the case across the country. What I said on the floor was, in our state, I've talked to hospital administrator after hospital administrator on both sides of the state and at the top and the bottom of the state, who and in the middle of the state where you are, who say their fastest rising group of unpaid hospital bills are from people with insurance. And that seems illogical until you think through it and realize that now so many people with insurance have deductibles that they just simply can't pay. I mean, a $3,000 deductible is becoming more and more common. $7,000 or $9,000 per member of the family is not uncommon as we talk to people who are now trying to get insurance that they can pay for. And mostly this becomes a catastrophic insurance plan with the ability to have an annual checkup, perhaps, rather than an insurance plan that really makes you feel like if something bad happens, you and your family are covered, and you're not going to be fighting with the hospital about paying the first $3,000 or $4,000 of a bill that you can't pay. I think I said on the floor yesterday too that if your deductible was $500, think back to where most people were just a few months ago. Most families, to satisfy the situation, to move on, they've done everything they could to have insurance. could scrape together $500. Maybe a little bit painful, but they could figure out how to do it and pay that and say, okay, that's done. Now my insurance company's taking care of everything else. But if the bill they get is $3,000 or $7,000, most working families look at that and think, we just can't do that. So our insurance company is going to pay whatever is above that. Maybe the hospital will leave us alone, but it doesn't really. And so there's no reason to pay even the first $500 of a $7,000 bill if you look at this from the lens of a family trying to get by, trying to pay the bills, who has plenty of other costs, and now health insurance doesn't protect them the way they had hoped it would.
From me, Senator, you're going to get a thank you and a attaboy, and please keep fighting that fight on Obamacare. Eagle News Time is 7:43. United States Senator Roy Blunt is with us, and News Director Brad Trinago.
Senator, a few days ago, we learned about another shooting at Fort Hood. Just yesterday, a teenage boy apparently stabbed 22 people at a Pennsylvania high school. You've been a strong supporter of some reforms in terms of mental health in this country. What can you tell us about the status of that process?
Well, I have been a strong supporter of mental health reform. You know, as a society, for whatever reason, we have never wanted to deal with this. Our state is quite a bit better than lots of states in trying to lead the way on mental health reform, trying to find ways that people who deal with groups, particularly people dealing with young people, have the opportunity to be part of something called mental health first aid, where you don't become a mental health provider, but you do become somebody who's prepared to say, I think this individual needs some help, and I'm going to find out how I can see that they talk to somebody that does that. We got a bill passed as part of the doctor reimbursement plan under Medicare, where there was so-called annual doc fix bill, where we've got this phony pay for that the Congress put in place years ago that's never actually been allowed to happen because it was unreasonable at the time. But that means every year we have this bill. And the Senator Stabenow from Michigan and I were able to get an 8-state pilot project where mental health would be paid for like all other health is paid for at federally qualified clinics that want to add a behavioral element or are really strong Missouri mental health clinics if they become part of that. And, you know, what I've said since the Sandy Hook disaster and before, I said this the very next morning when I was asked the first question about what happened, the tragedy at the elementary school, that the one consistent thing is that somebody has a behavioral health problem that hasn't been dealt with, maybe hasn't been shared in the community among law enforcement agencies like it should have. But that's the one consistent thing. It's a different location. It's a different weapon. It's a different set of victims. But the one consistent thing is somebody that has a behavioral health problem that has not been dealt with properly. And we're trying to create an environment where that happens. Let me tell you one other thing, guys, on that. After the Sandy Hook, that terrible elementary school tragedy, the Senate committee that deals with mental health issues had a hearing the next month in January. That was January of 2013. It was the first hearing that Senate committee had on mental health since 2007. This is just a topic that we have not dealt with in a realistic way. And the National Institute of Health says 1 out of 4 adult Americans has a diagnosable and treatable mental health challenge that they just need to have it dealt with, like in most cases, like they deal with all other health problems. And, you know, whether it's a soldier at Fort Hood or a teenager at Sandy Hook, or we'll see more about this situation yesterday, it's a problem that the society could deal with in a much better way.
And I have to say, on the subject of mental health, the fact that with the Senate Appropriations Subcommittee and the hearing on defense health, you brought up and you were questioning, you know, this Armed Services panel regarding mental health services. And obviously we have a lot of troops that have some issues and they need our help. And I really appreciate you digging into that.
Well, and on the bill I talked about, the Excellence in Mental Health Act that we got the pilot project on, all kinds of veterans groups were supportive of that legislation. A significant group of law enforcement groups were supportive. The mental health advocates were supportive. And yesterday, I asked the the Surgeon General, rather, of the Army. I gave her that statistic I just gave you, 1 out of 4 adult Americans. Is your view that that's reflected in the military? And her answer was yes. We recruit from the general population. There's no reason to believe that people entering the military don't have about that same ratio of challenges that, if treated properly, can be dealt with. And the other thing I pointed out to her was that of the veterans' suicides, a significant number of veteran suicides don't involve veterans who were in Afghanistan and in Iraq, were at the battlefront. They're veterans who leave the military and through depression and other things eventually wind up taking their lives at numbers for those who have served us in uniform that we shouldn't allow to happen as a society if there's some way to intervene like we would if they had any other kind of health problem to deal with a mental health or behavioral health problem. And the other thing I'd want to say here too is if you have a mental health problem, the odds are much greater you're going to be the victim of a crime than the perpetrator of a crime. But these tragedies are another reason to call attention to the fact that we have this problem, we need to deal with it, and I'm pleased to say that Missouri has for decades generally been in the lead of trying to do things that deal with behavioral health like we deal with any other health problem.
749 with Senator Blunt. And one final question, Brad.
Yeah, there's a vote in the House today, Senator, on a proposed budget. It purports that it'll balance the government's books eventually. It gets there with a lot of cuts to programs like food stamps. Now, the AP reporting that it's not really expected to pass eventually, at least through the Senate or at least through the president's desk. But it's more about giving the public an idea of what the GOP would do if Republicans got the Senate in November. What are your thoughts on Congressman Ryan's proposal?
Well, a budget is just that. It's a blueprint. It doesn't go to the president's desk. It doesn't have to be signed into law. But it does give you a pathway to determine your priorities and appropriate the money and to get us headed in the direction that would guarantee a balanced budget. Now, personally, I'm for a balanced budget amendment where the Congress has no choice but to balance the budget and whatever is whatever the amount of years you'd have to determine to get that amendment passed. But the sooner the better. And the big challenge for a Republican House and a Republican Senate, if my side does get the majority in this election year, would be to establish that blueprint right away and show the country what Republicans could agree on and what Republicans would be willing to do. Of course, the Democrats in the Senate have already announced that once again, for the umpteenth time, as my mother used to say, they're not going to have a budget. They say, we've got a top line, that's good enough. Well, you know, the fact is the top line is not good enough. It may be good enough to barely get you by 1 year, but it doesn't give you the pathway that the country needs to get our debt under control, to get our annual so-called mandatory programs that we don't even appropriate for where they can survive and be there for people that need them, and the ones that people don't need, we need to evaluate how you move on from changing those programs. But the budget's a big deal. The Democrats in the Senate say once again, we're not going to have one. Last year we had one only because the House figured out how to put in a bill a requirement that senators wouldn't be paid if there wasn't a budget drafted last year. And so for the first time in about 7 years, Democrats in the Senate were willing to bring a budget to the floor, and they say they don't really think that's necessary again this year. The law requires it, and it'd be nice to see both the president and the Congress comply with the law, and I'm doing everything I can to try to find tools to make that complying with the law happen.
Roy, thanks so much for spending some time with us this morning. I know you're a very busy person, and we always wind up getting into discussions and eating up your time this morning. Thank you very much, and let's meet again here soon, all right?
Hey, good. It's good to know the Eagles flying again today, and I will see you guys soon. Great to talk to you this morning.
All right, thank you very much. United States Senator Roy Blunt.